Hello, and thank you for taking the time to view this information about the Child and Teen Checkups, or C&TC program. Presenting today is Renee Lucassen, C&TC Coordinator for Cass County. Child and Teen Checkups, C&TC, is the name for Minnesota's early and periodic screening, diagnosis, and treatment program, otherwise known as EPSDT. C&TC is a comprehensive child health program provided to children and teens from newborn through the age of 20 who are enrolled in medical assistance, otherwise known as MA. It is a federal mandate that all states must have an EPSDT program, which in Minnesota is C&TC. EPSDT is a federal program required in every state to provide preventative and comprehensive health care and dental services for children under the age of 21 who are eligible for Medicaid. Periodic examinations or screenings are delivered according to the C&TC schedule of age-related screening standards. There are 5 main goals of an EPSDT program, which include performing early screenings to assess and identify problems early on, periodically checking children's health at age-appropriate intervals, providing screenings for physical and mental health along with developmental, dental, hearing, and vision to detect potential concerns, performing diagnostic tests to follow up when a risk is identified, as well as treating the child to control, correct, or reduce health problems. The Minnesota Department of Human Services, or DHS, as well as the Minnesota Department of Health, or MDH, both play an important role in providing the C&TC program in Minnesota. DHS helps people meet their basic needs so they can live in dignity and achieve their highest potential. Likewise, MDH is committed to creating and improving health throughout the state of Minnesota. Health in early childhood can have a big impact on helping families to create their own healthy futures. Well child health care and preventative screening support the mission and goals of healthier Minnesotans. The role of DHS is to administer the C&TC program in Minnesota, as well as set the program requirements and policies, billing guidelines, and coding standards. On the other hand, the role of MDH is to provide consultation, technical assistance, recommendations, and best practices regarding well child care to DHS, C&TC providers and coordinators, clinics, counties, and tribal nations. Those who are eligible for C&TC include children ages 0 to 21 who are enrolled in medical assistance, including straight MA or a prepaid medical assistance program, also known as a PMAP, which in Cass County includes Blue Plus and UCare. What is public health's role with the C&TC program? Our C&TC staff provide outreach to eligible families and children ages 0 through 20 years to inform them of the program, especially those families who do not yet participate in C&TC services. We also provide assistance to families in accessing C&TC services, as well as collaborate with local providers who perform the well child checkups to ensure best practices. The C&TC coordinator for Cass County Public Health is Renee Lucassen. She is also the supervisor for the Children, Youth, and Families Public Health team. Her role for C&TC is to coordinate the C&TC grant budget, work plan, and reporting. She provides assistance to clients in finding providers, transportation, and interpreter services. She also reviews health data, such as immunization rates, to help guide future C&TC work. The C&TC outreach workers contact newly enrolled C&TC clients to explain the program and its benefits, send them introductory letters to the program, and provide reminders to current participants to schedule their next appointment based on the child's age. They also follow up with participants when a referral has been made to offer reminders or assistance with scheduling the appointment or finding a provider. The outreach workers track all outreach activities. Cass County C&TC is unique in that it contracts with the 3 family centers in the county to have a C&TC outreach worker in 4 different communities. Amy Carlson works out of Health, Human and Veterans Services office in Walker, and Angie Zwart works at the Northland Area Family Center in Reamer. Michelle Spar is at the Pillager Family Center, and Luann Gravel is at Pine River Bacchus Family Center in Pine River. The goal of the C&TC program is to improve the health of eligible children and teens by finding problems early to prevent long-lasting harm to the child's health. It has been proven that preventative health care can reduce medical care costs through early diagnosis and treatment. For example, if a small cavity is detected early, it can be treated with a minimally invasive restoration and low-cost procedure. However, if a child does not receive routine dental checkups to detect problems early, it can result in long-term damage to the teeth and a more costly and extensive treatment plan. For a variety of reasons, many people don't get the preventative health care they need. Barriers include cost, not having a primary care provider, living too far from providers, and a lack of awareness about recommended preventative services. Teaching people about the importance of preventative care is key to making sure more people get recommended services. So why are child and teen checkups so important? Regular comprehensive checkups give families and healthcare providers an opportunity to monitor children's growth and development, screen for and identify potential concerns, and treat them to prevent bigger problems later on. If children get a healthy start in life early on, they are more likely to grow up to be healthy adults. The Centers for Medicare and Medicaid Services, also known as CMS, has set a goal for states to have an 80% participation rate in EPSDT screening services. Participation rate is based on eligible children receiving C&TC screening services during the reporting year, which is the federal fiscal year. CMS uses the CMS-416 Federal Report to measure these rates. Accurate billing and coding is critical for Minnesota to reach the 80% participation rate. In fiscal year 2023, the Minnesota participation rate was about 50%. Can you guess how many children are eligible for C&TC in Cass County? As of fiscal year 2023, there were 4,970 children eligible for C&T services in Cass County. Cass County Public Health worked with 3,029 of these children and Integrated Health Partnerships, or IHPs, with 1,941 eligible children. If a child who is eligible for C&TC is connected to a provider within an IHP, that IHP will now be providing the coordination of services for C&TC. Those children who are current C&TC participants but not through an IHP provider, and those who are eligible but have not recently or ever received preventative health services through C&TC are still contacted by Cass County Public Health to assist with the coordination of services of C&TC. What was the 2023 Cass County C&TC participation rate? For fiscal year 2023, the participation rate was 39%, a slight trend upward after a 5-year decline. A large decrease occurred from 2017 to 2018 when the periodicity schedule was updated to recommended checkups every year for ages 6 and older rather than every other year, as well as an additional checkup at 30 months old. There was also a decrease in participation in 2020 and 2021 due to the COVID-19 pandemic. The C&TC periodicity schedule shows at what ages children should receive their Well Child Checkup or C&TC. It is important for us to remind parents and guardians that preventative visits are always covered under medical assistance, as concerns about medical costs is often a barrier to receiving proper health care. Child and teen checkups and well child checks follow the same recommended schedule. The difference between the two is the additional benefits available to those who qualify for C&TC services. The C&TC periodicity schedule establishes the minimum frequency, timing, and content of preventive health visits scheduled at key developmental ages based on data from the American Academy of Pediatrics. The schedule is updated every few years based on recommendations from several state and federal organizations, such as the Centers for Disease Control and Prevention and the United States Preventive Services Task Force, just to name a few. Studies have shown that children in lower income families experience a disproportionate burden of health problems, especially related to vision and hearing, behavior, elevated blood lead levels, and oral health. Using this periodicity schedule helps ensure that every child is receiving the comprehensive health screening they need. It also helps ensure that all the required and recommended components are covered for complete coding and billing of a C&TC visit, helping to raise the participation rates. The back of the periodicity schedule holds reminders about special circumstances, changes to the schedule, and important points to take note of, along with clarifications for some components. The referral codes for billing are defined here, with a reminder that a referral code is required at every visit, even if there is no referral, which has its own referral code. There are hyperlinks throughout the document that open various documents, including the updated fact sheets or screening tools. The DHS Provider Guide for Child and Teen Checkups is found online. It contains all the information needed for providers and clinics, including an overview of the program, eligibility information for both members and providers, what services are covered and what services are not covered, screening exceptions, requirements for authorizations, billing details, referral code information, helpful resources, training and e-learning modules, and legal references. The main components of child and teen checkups include anticipatory guidance and health education, measurements, review of health history, a complete physical exam, developmental, social, emotional, and mental health screening and surveillance, immunizations, lab tests and risk assessments, oral health, including dental varnishing and hearing and vision screening. Any needed referrals will also be made during the C&TC exam. There are other components that occur less frequently throughout the age span, which is why referral to the periodicity schedule is so important. C&TC can be used for WIC, school, and sports physicals, and even one's first OB appointment. Child and teen checkups also include a developmental and/or behavioral assessment. For children under the age of 6, providers document normal and abnormal findings in social, fine motor, and gross motor skills, as well as cognitive, speech, and language development. On the other hand, for children over the age of 6, providers document normal and abnormal findings in motor, language, vocational, and attention skills, as well as cognitive and social development. Some additional benefits of a child and teen checkup include interpreter services, transportation to and from C&TC appointments, as well as dental exams twice per year per child. If you have a client that needs assistance locating any of these services, you can direct them to either call the customer service number on the back of their insurance card or call us at Cass County Public Health C&TC staff. We are always happy to help. An available resource for participants is this medical provider resource list. This medical provider list includes C&TC providers within or surrounding Cass County that accept MA. This medical provider list is updated at least twice per year and is given to all new families participating in C&TC. The list is available on our agency's website, www.casscountymn.gov, or you may request a printed copy by contacting the C&TC coordinator or outreach workers. Another resource for clients is the dental provider list. This dental provider list shows providers within or surrounding Cass County that accept MA. This dental provider list is updated at least twice per year. This list is available on our agency's website, www.casscountymn.gov, or you may request a printed copy by contacting the C&TC coordinator or outreach workers. Finding a dental provider in Cass County that accepts MA continues to be a concern. This guide helps families find a place to start their search. Each PMAP health plan, including Blue Plus and UCare, has incentives for different types of visits. These incentives are updated annually by the insurance provider at the start of each new year. We encourage you to be aware that these additional benefits exist and be familiar with how to direct participants to use them. Shown here are examples of the PMAP rewards offered by each PMAP provider in Cass County. This is only a partial summary of the rewards available. Participants can visit their PMAP website for a full list of rewards and instructions on how to request the rewards. They can also contact the number on the back of their benefits card or contact the Cass County C&TC team. This slide contains DHS contact information. This slide contains MDH contact information. Thank you for viewing our introduction to the Child and Teen Checkups program. We appreciate you taking the time to learn more about the C&TC program. If you have any questions about C&TC, please do not hesitate to reach out to us via our contact information listed here.